know, according to the latest statistics, a new baby is born every 8 seconds. But the reality is that conception is not so easy for many women. OBGYN Jessica Shepard lends her expertise to the parenting website bundu.com, and she's here with some tips for women who are trying or thinking about trying to have a baby. And we really need to think about overall health. It's not just this idea of conception, it's actually getting ourselves healthy beforehand, and that includes even what we eat.
I think that a lot of people think it's very easy to get pregnant, and then when you try, they realize maybe it's not as easy as I thought. So yes, having your body in shape before even trying to get pregnant is key. And I think that women don't necessarily think that they need to visit their doctor before trying to get pregnant, but they really should, to get the counseling that they need if they have any medical conditions, to make sure that those are taken care of. So making sure you eat your leafy green vegetables, your protein, also taking prenatal vitamins before you start to get pregnant, and folic acid before you start to get pregnant, to really ensure that you're starting a healthy pregnancy from the time of conception.
Right, and so you know, and try to
Yes.
reduce the chances for birth defects
Yes.
and things like that. When you talk about a healthy diet, I think it brings up this idea of weight, and I think what many women have no idea about is that if you're overweight when you're trying to get pregnant, that is actually going to hinder your
It really
process.
does. And all the diseases that come with obesity as well. When you have obesity, you have an increased risk of having diabetes, hypertension, polycystic ovarian syndrome, and all those things lend to creating an issue with fertility and conception. And so when you have obesity, studies have shown that you really do have a decrease in conception.
So when you go to the doctor,
Yes.
what are some of the key questions? Because I think people are like, all right,
Yeah.
I'm supposed to come now.
You're like, what do I say?
What do I say?
when I get there? And that's the reason that bondu.com is so important. It really does foster that relationship with a doctor, establishing that relationship when you get there, but also what questions do I ask? So bondu.com is an online forum that helps patients and women interact with their doctors and child care experts. So questions that you want to ask are, do I have a family history of diseases that, again, might hinder me being pregnant? Am I optimal to be pregnant right now? Or the things that I need to take care of? And also age. Age is a very important factor that you need to consider when you're going to your doctor and becoming pregnant. Have the conversation before, in your 30s, your late 20s. So even if you want to get pregnant later and you want to hold that off, you know all the options that you should consider after the age of 35. Knowing your options.
Right, and women have long been told that if we wait too long, it's going to
Yes.
be more difficult. How long do you suggest that you try it on your own before seeking fertility help?
That's the perfect question. So less than 35 years old, we really like to see you try at least like very good effort. So knowing when you ovulate and trying every time you ovulate for about 12 months. When you get to
wow.
yeah, absolutely.
So you have to be
Because like
patient.
yes, very patient. When you get to that 12-month mark, if you haven't conceived by that point, then you can, consult your doctor. And they should know during this time that you're trying. When you get to that 12-month mark, then you can, go to other options. Over the age of 35, we're playing with a little bit of time on age.
Right.
So you really want to shorten that duration. 6 months of trying, go talk to your doctor about that.
And if you're taking any kind of medication,
Yeah.
is there anything that's going to hinder that process?
Yeah, you really want to make sure, again, and that's why you should visit the doctor before. So if you have any hypertension disorders, if you have any diabetes tends to get worse during pregnancy. So you really want to fine tune and control your diabetes, one, before you start to get pregnant and when you do get pregnant, because it really can wreak havoc on your body.
If you have the high blood pressure and you're taking high blood pressure medication, is that going to hamper or is that going to help you?
You should be on the medication, but there are some medications that you should not take during pregnancy for high blood pressure. So you want to make sure that you go over that with your doctor, go over the list of medications that you're on and make sure they're all fine for pregnancy. And again, that's something that you can talk about on bondu.com and get a list of those medications so you know what's good and what's not.
And then we can make the adjustments.
Yes,
Thank
absolutely.
you very much
You're
for
so
being
welcome.
here. It's always such great advice. If you want more advice and information, you can visit bundu.com, and we can certainly link you there from our website as well, WGNTV.com/midday.